I'm coming into the patient's room and I have done my caring care. I know that this is Mary. She's a 78-year-old female and she was complaining of shortness of breath. So I've introduced myself, and now with gaining her consent, I'm able to proceed with my OP cures to you. So Mary, when did this pain, the shortness of breath start?
Started like 15 minutes ago.
15 minutes ago. And what makes it worse?
If I'm lying flat.
Lying flat. And what makes it better?
If I'm sitting up.
Sitting up, okay. And how does it feel like when you're having the shortness of breath?
I feel like I'm suffocating.
Suffocating. And do you have an associated cough, pain, any bluish of the lips that you've noticed with the shortness of breath?
No.
No. And is it affected by your position at all? Do you feel like you're more short of breath when you're laying down?
Yes.
Yeah. And on a scale of 1 to 10, at your worst with that shortness of breath, what would you say that, how would you rate that pain or the shortness of breath?
I rate it about an 8.
An 8. And does it come and go?
Yes.
Does it happen at any, certain point in time of the day?
It's worse at night.
Worse at night. And do you take any medications for it?
I do have asthma, so I do take Ventolin puffers.
Ventolin puffers. Do you know what might be causing this shortness of breath suddenly?
I'm not sure.
Okay. Now Mary, do you have a cough?
No.
Do you have any shortness, chest pain while breathing?
No.
No. Do you have any history of respiratory illnesses other than for that asthma?
No, nothing else.
Do you smoke or live with a smoker?
No, I don't.
No. Are you exposed to any allergens, dust, or any chemicals, irritants in the air that you think that might be exacerbating the shortness of breath?
No.
And have you received your COVID vaccine yet?
Yes, I have.
Oh, okay. And do you take any other medications?
No other medications.
Do you have any allergies?
No allergies.
And are you a smoker?
No.
Okay. And I'm just going to take your blood pressure, take your whole vital signs. And for Mary, her temperature is 36, 125 over 85 is her blood pressure. Her pulse is 85 and regular. Her O2 sat is 98% on room air, and her respirations are 20. And so for my first part, I'm just inspecting Mary, and she seems very relaxed. Her respirations are non-labored and even. I did know that her respiratory rate is 20, which is within normal range. She's not using any accessory muscles, and I don't see any discolorations of her nails or her lips. On the posterior side, so if I can just get you to lean forward, I see that her scapulas are even, her vertebrae is aligned, and she's also sitting comfortably in the bed. Okay, Mary, so I'm just going to palpate your back, and you just tell me if you have any tenderness. I'm just checking for lumps, bumps, any tenderness, any maybe warmth or redness. Okay, no tenderness?
No.
Good. Now I'm just going to get you to bend your neck or your head. And now I'm just going to be locating, and so I've located my C7. I'm going down. And I've hit T3 and T4. T3 and T4, those are the oblique fissures on both sides. And I know that from my T3 to my C7, those are my upper lobes. And I'm going to keep going down. And here I've hit T10, which is the base of the lung. Now I'm going to check for symmetry expansion. So I'll just get you to take a deep breath in. Good. And we have even symmetrical expansion. The next one I'm going to do is tactile feminist. And so Mary, I'm just going to get you to repeat the word 99 as I will be touching the posterior of your chest in 10 different locations. Okay?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Good. All right, and now I'm just going to be tapping your back. So was landmark 1 and 2, 3, 4, 5, 6, 7, 8, 9, and 9. And so I heard resonant sounds throughout, which are normal percussion notes that you would hear in a healthy lung. Now I'm going to go over and auscultate. And so I'm cleaning my stethoscope, warming it up, and using the diaphragm. And so just take some deep breaths in and out for me, Mary, and you just let me know if you're feeling dizzy at any point and we can just pause. Okay, and then we have 2, and 2, and 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, and 9, and 9. Good. And so for the posterior chest, I heard vesicular sounds throughout the peripheral lung fields, except for when I got to between T2 and T5. That is where I heard her bronchovesicular sound, which are normal breath sounds. Okay, and I'm just going to be listening the front of your chest. And so again, same thing. You're just going to take some deep breaths in and out, and you just let me know if you're feeling dizzy at any time, and we can just pause. Okay. So I'm going to be listening to the top. So the apex of the lungs. And then I have located her second intercostal space. And then I've located her sixth intercostal space, which is anterior axillary line. And over on the other side. Okay, good. And so same thing, I would hear vesicular sounds. Once I've reached that second intercostal space, I should hear bronchovesicular, and then I heard vesicular on the peripheral lung fields. So for my S-part, hi, my name is Nicole. I'm a student nurse at Georgian College, and I'm taking care of your patient Mary, who's a 78-year-old female, and she was presenting with shortness of breath. She denies having a cough, there's no shortness of breath while breathing, and she has received her first dose of her COVID vaccine. She does not have any allergies, she does have a Ventolin puffer, and she is a non-smoker. Upon her vitals, when I took her vitals, they were, her temperature was 36, 125 over 85 was her blood pressure, her pulse was 85, 98% on room air, and her respiratory rate were 20. She said it started about 15 minutes ago, lying down makes it worse, and sitting makes it better. She states that it feels like she's suffocating. She denies any associated pain or cough, and she states that her shortness of breath is at 8 on 10 at its worst. It does come and go, and it worsens at night. She does not know what this could be. Upon my inspection, she's relaxed, her respirations are even and non-labored. Her posterior chest is non-tender on palpation. During percussion, I did hear some resonant sounds throughout, and upon auscultation, I heard normal breath sounds. Would you like to get a COVID swab done for this patient?